We have two questions before us tonight that I hope to move through. So question number one is, what are we as followers of Christ to make of the mental illness epidemic that we see happening in our culture? That's our first question. How are we to understand this? Our second question, and if you watched in the video that kind of opened up this evening, it talked about engaging in a caring way, in a kind way. So our second question, how do we as Christians engage mental illness in a caring and kind way? And to move us through these two questions, I have four kind of segments that I hope, thank you so much, whoever's running the PowerPoint. I have four segments that I hope to kind of move us through. So first, we're going to address the problem and clearly define what that is. Second, we'll talk about our understanding. And when I say our understanding, I will briefly speak to what my profession as a clinical mental health counselor understands in terms of what's driving this, or what we have tried to understand. And then I will talk about how we as Christians should understand what we see happening in our culture. Number three, we'll talk about the cause, and that will kind of be wrapped up with our engaging. So how do we respond to what we see happening in our culture? Now, this has been a big conversation that I've been a part of for honestly almost 2 decades now. My senior year in my undergrad in biblical studies, I knew that I wanted to work with adolescents, but I did not want to be a teacher. And as a professor now, I see the father's irony in that, because now I'm teaching multiple times a week. But I just knew I wanted to work with kids. So I was getting my biblical studies degree to planning on being a youth pastor. In my senior year, I had a class that really altered the course of my life and honestly kind of resulted in us being here together tonight. It was a class in pastoral counseling. And while I did not get the grade that I wanted in that class, I had found my calling. I walked away with a question. What if? What if we could do this? What if we could find a way to blend mental health with the restorative mission of Jesus Christ? What if there's a way for us to find ways to address depression, anxiety, loneliness, all these things that we see with redemption? And that set me on a path. So I moved 1,040 miles away from the farm to Denver, Colorado, and started my Master of Arts in Counseling degree at Colorado Christian University, which I now have the absolute honor to serve at. I love CCU. There are so many faith-based institutions right now that are wavering in their values, and CCU ain't one of them. And it is an absolute honor to serve the team and the students that I get to serve at and to be at CCU. After getting my master's degree in counseling, I still wanted to work with kids, and I wanted the kids that no one else wanted. I wanted the outcasts. I wanted the kids who had significant challenges, the at-risk kids. So I went to a maximum security detention center for adolescent males in Colorado, the maximum security detention center for adolescent males in Colorado. And I found myself for a couple of years spending every single day with gangbangers, murderers, drug offenders, sex offenders, violent offenders. I saw and heard things I would not say to you tonight. After a couple of years there, I transitioned and I started serving very similar kids on the streets. And I started engaging their families, their teachers, their coaches, their friends, anyone that I could engage and kind of build a wraparound service of this youth. And how do we help them find a way forward? Now, I mentioned Dr. Anthony Bradley earlier. If you have not had a chance to watch Dr. Bradley's speech on what's happening to young men in our culture, happened earlier this spring in the Lighthouse Voices series, you got to watch it. Dr. Bradley was spot on. It was a fantastic talk. Now, I saw the challenges that our youth were facing. But I've been in education now for about 10 years. I have a clinical supervision practice, so I'm constantly engaging on consultation and clinical services. But in 10 years, something has happened, hasn't it? The things that I feel like our youth and even us were facing 10 years ago has drastically changed. Something is happening in us. something is happening to us, something is happening around us, and even between us that has happened very quickly. Very quickly. So fast that I think it's hard for us at times to put terms around it, to actually speak about it in a relevant way, because we're still trying to understand the something that has happened. Now, John mentioned this as he was talking, but in 2015, there was two Princeton economists, Ann Case and Angus Deaton. They began noticing something in our culture. Now, John mentioned life expectancy. So in 2015, they noticed that life expectancy started dropping. Now, what do we mean by this? What we mean by this is my three kids, Aiden, Emma, and Lincoln, are expected to now have, on average, less life than they did before 2015. So the amount of years that our culture is now expected to live is shorter than it was in 2014. So in case Angus Deaton began watching this, same thing happened again in 2016, happened again in 2017, 18, 19, 20. And in 2020, Case and Deaton actually released a book called Deaths, Deaths, Deaths of Despair, outlining what they were seeing. And they set out to find why. Why are we seeing in the wealthiest country in the world, where we have very, very accurate access to advanced medical treatment, why is life expectancy dropping in the US of all places? Because now in this book in chapter 2, they actually have a chart, and they title the chart "All Things Fall Apart." Is what the chapter in this book as well, and Case and Deaton's book is actually titled "All Things Fall Apart." But in this chart, you can see that in every other country, mortality rates were decreasing. So life expectancy was increasing, mortality rates was decreasing. So we could see, let's say, in the UK, in Sweden, in France, life expectancy was increasing, mortality rates were decreasing. But then you see the US, and around 2010, we begin to plateau out. And then when we hit 2015, it begins to drop. We're the only one. Only one. And they couldn't figure out why. So they set out to figure out, why are we seeing an increase in mortality? Why are we seeing people die younger? Why do our kids now have projected less life ahead of them than our kids did 15 years ago? And what they found, 3 things: overdose from drugs, suicide, and liver disease from alcohol. So those 3 things. So let's take a step back and think about that for a second. So we all now have in the US less life ahead of us, expected, projected, due to the number of suicides, the amount of drug and alcohol use. Now, that is unprecedented. Now, what's even more interesting is what makes this drop in life expectancy even more unique. It has happened in the past, but this is not disease-driven. This is self-induced. These are decisions that as a culture, as an individual, we are choosing to engage in that's altering our life expectancy. So we are choosing to engage, right, in alcoholism, drug use. Now, there are some genetic factors in there, and I know that I maybe have some addictions counselors watching who are saying there's also a disease aspect of addictions, which that is a real thing. Suicide. All of these are self-induced to a certain extent. So we're not just seeing a decline in life expectancy because of a disease that's popped up. We're seeing a decline in life expectancy because we are choosing things that are killing us. This something that is happening in us, around us, and to us is manifesting itself in mental illness. So in their book, This is very interesting. Case and Deaton, as they're talking about deaths of despair, highlight that if you look at the last 2 decades, depending on the cohort, the age cohort that you're talking about, right? So most research goes from 12 to 17, and we go 18 to 25, then we start talking about adults, and then when we hit 65, we start talking about older adults. So depending on the age group, deaths of despair in our culture has increased anywhere from 56% to 387%. 387%, depending on the age group. The older the age group, the lower the percentage. The younger the age group, the higher the percentage. This is a real conversation for our kids at this point. Real. This is one of the new talks you have to give your kids. It's not just the birds and the bees anymore, is it? It's now about suicide. If you have thoughts of harming yourself, you can talk to me. It's become a common topic now. So, can we go back one more slide? I'm so sorry. Let me set this up. So first segment that we're going to talk about tonight is the problem. So we've already mentioned this. John mentioned this. John did a fantastic job setting us up tonight. The problem is lower life expectancy. Mental illness is at this point taking expected life away from us. We are losing life. We are losing lives and we are losing life. So let me unpack this a little bit. If you'll hang with me for 3 slides, I know no one has any fun talking about data and numbers, but if I may, just throw some data at you very quickly. I promise there's going to be an end to it. All right? Let me talk about 3 slides and just set the stage for where we're at when we talk about mental illness and this epidemic that we have in our culture. So, next slide, please. Okay, I'm going to move through this relatively quickly. So, APA, American Psychological Association, reported in 2019 a 52% increase since 2005 in adolescents suffering from major depressive disorder. Now, if you go up to the next age group, 18 to 25, that jumps from 52% to 62%. The same study showed a 71% increase in those reporting some type of serious psychological distress. That was since 2008. Since 2008, Twenge and other authors showed a 47% increase in suicidal ideation. 47%. Got 2 kids? You got 2 kids? Right? This is serious. And here's the thing. Here's the thing about mental illness. It hides. It hides. If my arm is broken, you could probably see it. This stuff operates unseen. And the reality is that many of us in this room, many of us watching online tonight, we're wrestling with this stuff. This is not a talk about others, is it, at times? This is a talk about where we're at. About where we're at. Interestingly, in these same studies by APA, we did not see a decrease in mental health in older adults, age 65 or older. It's hitting the youngest of us. The younger you are, the harder this is hitting. Next slide, please. Okay, 1 down, guys. 2 more. January 2022, 9 months ago. Took me a second there. I almost said 10. The National Institute of Mental Health reported on data collected by SAMHSA, which is the Substance Use kind of Association in America. And they reported on data that they collected in 2020. Now, these 2 organizations found 49.5% of adolescents, 13 to 18, had a mental health disorder, or what we call AMI, any mental illness. Of that 49.5, 22.2% had what we consider a serious mental illness. This is something that is dramatically impacting their ability to function in a normal life setting. So they are actually impaired in some way. Something is actually disabling them from functioning normally in their given environment, whether it's school, at home, friendships or relationships, whatever it is. Next slide, please. Final one, guys. Mental Health America reports 19.86% of adults have expressed any mental illness on average in 2022. Now, what's interesting is this report gave us some numbers to understand this by. So when we talk about 19.86%, this report made sure to mention that we're actually talking about 50 million people. The entire state of California has 40 million people. So a little bit of a comparison, right? So framing this. 19.3 million adults report having a substance use disorder. This is an addiction. 19.3 million, and then the entire state of New York has 20 million. 11.4 million adults have seriously considered suicide. That is a 664,000 increase from 2021. So in the last year, we have seen an increase in adult suicidality by 664,000 individuals, over 500,000. 15.08% of youth ages 12 to 17 report at least one major depressive disorder. That is an increase of 306,000 from 2021. These numbers are not going down. And they have not been going down for a long time. So, obviously, this catches my profession's attention. So we've talked, this is the problem, right? The problem is the crisis of the mind. Mental illness is now beginning to take life away from us. It is reducing our life expectancy. That's the problem. My profession, obviously, and rightly so, took note of this. So we began doing what I think we should have done, trying to understand it. What is going on? So in the last couple decades, we have pumped about $20 billion with a B dollars into research on mental health. And the institute or organization that typically leads this is going to be the National Institute for Mental Health, which has, for the most part of this century, been led by a man named Dr. Thomas Insel. Okay? Next slide, please. But here's what has happened. Andrew Skoll this year released a book called Desperate Remedies. So Andrew, speaking of Dr. Insel and the $20 billion that we have spent in trying to understand what's happening, writes, in 2015, no longer directing the National Institute for Mental Health and dispensing billions of dollars in research, Thomas Insel insouciantly summed up what all these dollars had purchased. And this is him quoting Dr. Insel. I spent 13 years at the National Institute of Mental Health really pushing on the neuroscience and genetics of mental health disorders. And when I look back on that, I realized that while I think I succeeded in getting lots, and this is a quote, lots of really cool papers published by cool scientists at a fairly large cost, $20 billion, I don't think we moved the needle in reducing suicide, reducing hospitalizations, or improving recovery for the tens of millions of people who have a mental illness. We're trying to understand it, but we don't yet. At least not in a way that is reducing mental illness. Now, I actually have a lot of respect for Dr. Insel. He did, I think, what any scientist or researcher would have done. There is something going on. We need to research this to understand what's going on so we can help. Now, this same year, so we have Desperate Remedies come out. Dr. Insel released his own book on his time at the National Institute for Mental Health. And we got to give credit where credit's due. His evaluation of himself is very similar. He recognizes it. He sees it. So next slide, please. Now, this is Dr. Insel. I knew that nothing my colleagues and I were doing addressed the ever-increasing urgency or magnitude of the suffering millions of Americans were living through and dying from. The scientific progress of our field was stunning, but while we studied the risk factors for suicide, the death rate had climbed 33%. While we identified the neuroanatomy of addiction, overdose deaths increased threefold. While we mapped the genes for schizophrenia, people with this disease were still chronically unemployed and dying 20 years early as compared to the average person. Why? Why was so much progress in neuroscience and genetics had we not reduced deaths or disability for people with serious mental illness? We're trying to understand as a profession, but we're not there. There's something I talk with my students tonight, or tonight I have students in the audience, but there's something I talk with my students about, and they're all just going to roll their eyes when they hear me say this because I say this all the time. I call this the fives and the one. There are 5 things happening in my profession, and there is one thing happening in my profession. My profession. There are more mental health professionals than there ever has been. And I'm here to tell you that there are more Christian mental health professionals than there ever has been. If I can quote C.S. Lewis for a second, Aslan is on the move. I'm serious. Some of the largest master's level counseling programs in the nation are all at faith-based institutions. The number one demographic of a counseling program seeking accreditation as a training program is faith-based institutions. I don't know what our profession is going to look like in the next 10 years, but I could not be more proud of the way in which our church is beginning to engage this conversation. It's actually really cool to watch. So, the 5s. More mental health professionals than there ever has been. We have more pieces of local and national legislation being passed that supports mental health professionals than there ever has been. There's better training for mental health professionals than there ever has been. There's still some stigma around mental health, but less stigma than there ever has been. There are still some access issues for mental health, people who are trying to find a counselor to go and see, but we have greater access than there ever has been. So more of us, more support and legislation, better training, less stigma, greater access. It's like the golden age of mental health. And yet we have the highest mental illness rates that our species has ever seen. Those two things don't quite go together. That's a very complex conversation, but no one's talking about that. No one's talking about that. So decades and $20 billion later, my profession does not quite fully understand what's happening. We've honestly got a lot of really important knowledge. Our research is fantastic. We've learned things that we should have learned. Sorry, guys, there we go. We've learned things that we needed to learn, 100%. But it hasn't done anything that has moved us in terms of lower mental illness rates. So that's where we're at. So my profession has got a lot of new knowledge that was needed, but it has not translated into lowering mental illness. Now, here's where things get interesting. As our understanding as a profession has kind of been hitting a wall, they may not know it or not, but they've begun adopting explanations. That's just Jesus. Let me tell you something. My profession has done nothing but plagiarize Jesus. We just took the way that Jesus is, and then we called it something different and said, that's mental health. Jesus was the first counselor, straight up. I think Isaiah calls him the wonderful counselor. He may have meant something different, but tonight we're just going to roll with it. So let's talk about how Insel understands this. Next slide, please. Now, this is where things get interesting. Insel, offering us insight, speaks of mental health disorders as years of productive life lost. What do you hear again? Life lost. That is how Insel, after $20 billion in research and leading my profession for 20 years, that's how he understands what we're seeing. He understands mental illness to be years of life lost. Now, what's interesting is that Insel believes the word that most accurately captures the ramifications of mental illness is disability. Now, let me reframe that for a second. Really, what he's saying is that mental illness disables us from life. It disables us in our relationships. It disables us at work. It disables us at school. It disables us with our parents, with our kids, whoever. There is a disabling element to mental illness. That is what he is speaking about. More interesting is the global burden of disease takes the exact same approach. They categorize in their data research mental illness under disability because they understand that there is a disabling factor to mental illness. Okay? So, years of life lost. Next slide, please. What's Insel's solution to this? He calls it recovery. Now, I wish you would have chose a different word. When my profession hears the word recovery, we think of addictions. That's not what he's talking about. What Insel is saying is that we need to be recovered. If I could reframe it, we need to be redeemed. He is talking about how we need to be taken back from this. Something needs to come and recover us from the illness that we're in and give us life back. So he defines recovery as more than just a reduction in symptoms. And listen, for a counselor, it's like, oh, you have depression? Okay, let's figure out how to make you less depressed, right? That's a reduction in symptoms. But Insel says it's way more than that. It is more than just fixing the problem in front of you. It's more than just reducing symptoms. Here's where things get interesting. It is a return to a full and meaningful life. That is what recovery is. If we are going to be recovered from this, if you're going to recover someone as a follower of Christ that you know is in the thralls of a mental illness, it means helping them get back to a full and meaningful life. So then we as mental health professionals or followers of Christ, of the Most High God, when we hear of mental health crisis, the opioid epidemic, or alarming adolescent suicide rates, John mentioned Colorado. Right now, Colorado is 50th in the nation for adolescent mental health treatment. The only, and I know it's not a state, but the only entity is DC. DC is the only entity defeating us. Or that has worse adolescent mental health rates. We often lead the nation in adolescent suicide rates in the Colorado Springs area. It's an epidemic in Colorado. But how should we understand this? My profession, right, is trying to understand it still. Rightly so. Good research, awesome people. I could not be more proud to be a mental health professional. I'm very proud of it. But we're still trying to wrap our minds around it to a certain extent. How should we understand it? We're losing life. We're losing life. We should understand all this data through the lens of years of a full and meaningful life lost. Now, when I hear full and meaningful life, there's something else I think of. Next slide, please. Man, oh man. The thief comes only to steal and kill and destroy. But I've come to recover you. I've come to recover you. I've come to move you back towards a full and meaningful life, towards an abundant life. Gang, the church has a role in this. The church has a role in this. Rise up. Rise up. This is our time. My colleague, Dr. Andrew Wichterman, is here tonight. He speaks of a remnant of the church and how in the Old Testament, when the Hebrews were almost completely wiped out, there was always a remnant. There was always a remnant that found their way back. We need a remnant to rise up. So, I just love that. If I could do a mic drop, that would be it. Talk over. So, we talked about the problem, right? We're seeing a loss of life, a reduction of life due to mental illness. We've talked about our understanding. My profession has been trying for decades with a lot of money to gain an understanding that actually reduces mental illness. We are gaining understanding, but we have not reduced mental illness just yet. For us as Christians, we are to understand mental illness as years of life lost, that we need recovery. And here's an interesting thing. Insel, as he talks about recovery, he writes, there are three things that you have to address in recovery. Three things. The three P's. People, place, purpose. We need to engage people. And the people that probably need your engaging are people you don't want to engage. You don't want to engage them. They probably think differently than you. They probably vote differently than you. They probably live differently than you. All the things. Those are the people that you need to engage. 2, place. All of us have challenges. We all have a unique place that we live in, unique challenges to our environment, our socioeconomic status, whatever it is. All of us need someone to come alongside us and help us move out of the place that we're in. I'm holding off on giving a rant on tzedakah and mishpat. Real quick. So sorry. Real quick. In the Old Testament, Queen Sheba, when she comes to see David, because she had heard all of these rumors and stories about how awesome, Solomon, not David, how awesome Solomon was. Some of you were like, this guy's wrong. I heard it. Solomon. She didn't believe it. So she travels all the way and she gets there and she sees that Solomon is what she had heard. And you know what she says to him? This pagan queen, surely God has put you on the throne to pursue his righteousness and justice, tzedakah and mishpat. Now, what's interesting is from that, we get this idea of what's called Jewish justice. It is something other than social justice. Jewish justice has this thing called the quartet of the vulnerable. It's the most vulnerable people in our society. And at that point, it was the poor, the immigrant, the widows, and the orphans. And Jewish justice, tzedakah and mishpat, righteousness and justice, look in the Old Testament. Those two are always together, everywhere throughout the Old Testament. Righteousness and justice, all over the place. In Hosea, God says, I will betroth you to me in righteousness and justice. I will marry you in righteousness and justice. And God's idea of righteousness and justice meant that we give of ourselves to help the most vulnerable around us. Now, by the time that we get to the New Testament, those two words in Judaism had become so interchangeable, they had merged into one word, dikaiosune. And it translates into righteousness in the Bible. When you pray on the breastplate of righteousness, you are praying on dikaiosune. You are praying on Jewish justice. And you are committing to use whatever the Father has given you, skills, resources, talent, to raise up those around you. That's the difference between biblical justice and social justice. Social justice wants to find equality by taking and giving. Biblical justice lends. I will give what I have to raise you up. I will recover you. I will recover you. Okay, rant over. My students in my classes actually count the number of rants that I go on. So we've covered the problem. We've covered our understanding. Now let's wrap up with our cause and our response. Like, how do we engage? They're kind of both, okay? In June 2021, a guy by the name of Rosemarin published an article in Scientific American. The title of it was Psychiatry Needs a Reckoning with God. Very interesting stuff. I couldn't pass it up. My wife and I were actually taking some time together up in Estes Park, Colorado, and I said, I got to stop. I got to read this. She's very patient with me. So David Rosemarin writes this article, and he says something really interesting. In the past year, American mental health sank to the lowest point. Now remember, this is 2021. So we all know what happened in 2020, right? So 2021. In the past year, American mental health sank to the lowest point in history. Incidence of mental disorders increased by 50% compared with before the pandemic. Alcohol and other substance abuse surged, and young adults were more than twice as likely to seriously consider suicide than they were in 2018. And then there's a word, but. But the only group to see improvements in mental health. There was a group that actually saw improvement in mental health during COVID, right? Interesting. The only group to see improvements in mental health during the past year were those who attended religious services at least weekly, whether in person or online. 46% report excellent mental health today versus 42% 1 year ago. He goes on. My own research has demonstrated that a belief in God is associated with scientifically or significantly better treatment outcomes for acute psychiatric patients. And this is where I would say something directly to my colleagues. He writes, healthcare professionals falsely disconnect common spiritual behaviors and experiences from science and clinical practice. As a result, we ignore potential spiritual solutions to our mental health crisis, even when our well-being is worse than ever. End of talk. Everybody go home. What? Why? Why in COVID? Why in COVID were people who were going to church actually getting better in their mental health when everyone else was actually decreasing? And listen, we let's just be honest. Christians aren't immune to this stuff. Like there's no following Jesus, so I never get depression. Right? That is not true. We struggle. Peter was crucified upside down. Paul most likely had his head chopped off in Rome. We experience the same struggles the rest of the world does. We just have something on the other side. We have hope, right? Listen, Scripture. My fear sometimes is that we have become consumers of the Bible rather than readers of the Bible. We show up to church, tell me what it says, tell me what I should take away from it, see ya. That's not how it's supposed to work. When we engage Scripture, when we have a relationship with the Almighty God and the Savior, it gives us a perspective. It helps us have some type of understanding or lens to what is happening around us, to us, in us, amongst us. We have perspective. So in the midst of COVID, why were people who were going to church actually being okay in terms of mental health? Because there was a God that they knew, and they trusted that everything was going to be okay. It influenced their perception. That's it. The answer is simple. They turned to something outside of and greater than themselves to find meaning and purpose. Now, in the fall of 2020, John and I mentioned this, I began to see something very interesting in clients. I began to see what I was beginning to call treatment-resistant depression and anxiety. Here's what I mean by that. We were beginning to address, or we're not beginning, we were addressing depression and anxiety through our normal treatment protocols. How Dr. Wichterman and I would normally treat, let's say, someone who has depression. We were doing that, but it wasn't going away. Couldn't figure it out. Same thing with anxiety. Now, we were in the midst of COVID. So at first, I just assumed, you know what? No wonder the anxiety is persisting. No wonder the depression is persisting. We're about 8 months into a pandemic at this point. But something happened. I decided to begin telling my clinical supervisees, why don't you transition? Don't treat them like they have depression anymore. I want you to begin using a theory that we call existentialism and a theory that we call logotherapy. And this deals with meaning, purpose, and hope. Meaning, purpose, and hope. And guess what we began to see? We saw a response. We saw things begin to alleviate. So I kept telling all my supervisees, meaning, purpose, and hope. Yak about it in sessions. Bring it up. Challenge them. Where are they finding meaning, purpose, and hope? What is their meaning and purpose and hope? Gang, The reason why meaning and purpose and hope is so profound for us to talk about right now is simply because of 4 words. We don't have it. We don't have it. We have spent several decades now tearing down anything and everything that gave us any type of meaning, purpose, and hope outside of ourselves. Anything that gave us any type of anchor outside of ourselves. And if you want to sit back and watch a show, reduce something to me and watch how I destroy it. Watch how I just tear it down. We need something outside of ourselves. We are wired in a way that if there is nothing outside of me that is giving me meaning and purpose, something that's helping me understand what's happening, mental illness simply occurs. It's almost like a math equation. It's fascinating. We are starved for meaning and purpose and hope. And listen, this isn't just outside the church. This is inside the church as well. Do you know what your meaning and purpose is? As someone who follows Christ, are you actively pursuing that? This is not just something outside the church. In many ways, the church is also starving for meaning and purpose and hope. Suicide rates aren't a non-Christian thing. It's an all of us thing. Right? Now, there's this guy called Viktor Frankl. Have any of you ever heard of the book Man's Search for Meaning? Slam dunk book. Everyone in our culture right now needs to read it. Man's Search for Meaning by a guy named Viktor Frankl. It'll turn your world upside down. Everything we're seeing, he calls neugenic neurosis. Now, new is the Latin word for meaning. So neugenic neurosis. And what he calls this, what he basically says is this is a tension point psychologically. Let me just read this. A cognitive tension or illness that arises not from psychological problems. It arises in the mind, but it's not arising from psychological problems, but from existential frustrations, specifically our meaning. It is a life philosophy problem. It is a worldview problem. So it's a state of having no meaning, no purpose, no hope, and nothing giving it to us. Neugenic neurosis. And as a result, we see mental illness occur. Frankl wrote, I turn to the detrimental influence of that feeling of which so many patients complain today, namely the feeling of the total and ultimate meaninglessness of their lives. They lack the awareness of a meaning worth living for. That's interesting. There's that life word again. They lack the awareness of a meaning worth living for. They are haunted by the experience of their inner emptiness, a void within themselves. This void, this inner emptiness, Frankl called this an existential vacuum. So what do we do? What do we do with this? So, problem. We are seeing mental illness skyrocket out of control. We all know this. It's not just happening to others. It often touches us at home. This is something all of us go through. As a result, we're seeing a loss of life. Our understanding. My profession has spent decades and $20 billion in research getting an understanding, but we have not reached an understanding yet that has reduced mental illness. Our understanding as believers, there is something happening in our culture that is taking life from us. We need to be recovered. People, place, purpose. We serve a God who's in the business of recovering. The cause. A neugenic crisis, neugenic neurosis, an existential vacuum. We no longer have anything giving us meaning and purpose outside of ourselves as a culture. So there's three things that I think any of us can do. Whether you're a counselor, whether you're just a layperson, any of us can do. Number one, we bring healing and hope to others, or we bring healing and hope to others. But bringing healing and hope to others means we must first find healing and hope ourselves. Let me tell you something. The journey of a healer is a journey of being healed by the healer. So if tonight is something that is catching your interest and you're choosing, I am going to engage someone to bring hope, meaning, and purpose, you must first recognize that you yourself, we're a bit broken, aren't we? Be seeking the heart of the Father. Be pushing in. If I can quote C.S. Lewis again, one of my favorite things in Narnia is when the beaver was always like further up, further in, further up, further in. Gang, it is time for us to go further up and further in. Rise up into your relationship with the Father. Matthew 7:21, I believe, Matthew 7, when Jesus is talking about how he cast out all the people who were prophets and did miracles and cast out demons. And why are you casting it? Why are you sending us away? I didn't know you. I didn't know you. Push into relationship with the Father. We bring healing and hope, meaning and purpose when we have found our healing and hope, meaning and purpose in Him. This one I actually is kind of tied into this a little bit. I may have just given away the second bullet point. Do you know your purpose or meaning? Do you know your why? If I walked up, let's say some of you gentlemen in the room, and I said, why are you leading your family the way you're leading them? Why are you leading your family in a godly way? Why are you choosing to honor and be faithful to your wife? Would you be able to tell me a biblical reason why? Because my wife and our relationship is the representation of Jesus' relationship with us, right? We need to find and be able to articulate why we are the way we are. We have to tie it back to our meanings, and a lot of us can't. We just know what we're supposed to do and not do. But you've got to tie it back to your meaning and purpose. You have to be purposeful in your meaning, and the Father is giving you meaning. So we have to be able to articulate our purpose and meaning, and that is given. It's not found. There's retreats that you can go on where people will go and spend days trying to find meaning and purpose. Listen, it's given. It's given. So, first one, seek healing yourself, right? The journey of a healer is to be healed. Find your own purpose and meaning. Third, talk about it. Are you courageous enough to talk about why you lead your family the way you do? Are you courageous to talk about how you are at your job? Why you are the way you are in school? Why you're choosing to be abstinent in college? Why you're holding yourself back for your wife, for your husband? We have to be willing to infuse this into culture ourselves. Listen, culture just isn't going to somehow suddenly spring up one day and like, oh, there's Jesus in the culture. Nope. We have to bring it. We have to infuse it. We have to be willing to find our purpose and meaning, to find our healing, and then find ways to talk about it, find ways to give it to others. Those are three things that you can do, no matter who you are. And I challenge you to do it. Thank you so much for your time tonight.
Well, I hope you have found this discussion not only inspiring, but also informative. Christians have to be able to think, especially in this constantly changing culture, from a Christian worldview. To learn more and to find more discussions, please visit lighthousevoices.org. That's lighthousevoices.org.